Good evening, everyone, and thanks for joining us tonight for this question and answer session. My name is Dr. Mroueh. I'm a reproductive endocrinologist, a fertility specialist. I've been doing this for more than 30 years, and I'll be happy to ask, a lot of your questions tonight. The first question that I received is as follows. I am a 38 and my husband is 42. We have been trying for 3 months without success. Is it best to just keep trying a little longer, or should I think about seeing a doctor? Well, usually we define infertility as trying to conceive for 1 year if a woman is younger than 35 and 6 months if a woman is older than 35. So since you're 38-year-old, ideally we want to wait or you want to try for 6 months. However, it never hurts to start early. A woman has a limited quantity of eggs, and the sooner we find out if there is a problem or not, the better. So if you suspect any issue, you suspect that you don't see your period every month, you suspect that your partner may have an issue with his sperm, he's on some medication that may affect him, it's really good to talk early to your gynecologist. You don't have to see a fertility specialist yet, but just talk to your gynecologist. And be careful, a lot of doctors will tell you, hey, keep trying, you're fine. But usually, if after 6 months nothing has happened, it's really time to see a fertility specialist. I hope that answered that question. The second question was about the IVF process. Could you please explain the IVF process? How long does it take with a fresh transfer? So basically, an IVF process is when we take an egg from a woman, we fertilize it with a sperm, we make sure it became an embryo, we watch the embryo grow. Usually we like to watch it for 5, 6, maybe even 7 days. And if it's developing adequately, we can put it back inside the womb. How long does it take? Usually it takes approximately 10 days of medications to produce multiple eggs. And then when the eggs are ready, 2 days later, we take the eggs out. And then again, 5 to 7 days later, we will know how many embryos we have, if we want to freeze them, if we want to transfer a fresh embryo. So I would say an average of 20 days from beginning to end of an IVF cycle. Now, definitely there are going to be a lot of preparation before that. There will be blood testing, there will be ultrasound, just to have an idea about how many eggs you have, what medications we're going to use, how is the sperm doing, etc. But again, once you start the IVF cycle, I would say around 20 days, 21 days, we will find out how many embryos we get, and we can transfer a fresh embryo. The third question was, how many insemination would I recommend before switching over to IVF? It really depends on many reasons. What is the cause of the infertility? How does the sperm look like? Is it a good sperm? The sperm is not really good. How old you are, etc. But honestly, IVF always gives such better success rate than insemination. So it's never wrong to move faster to IVF. And my recommendation, especially if you are above the age of 35, maybe 3 inseminations and then move straight to in vitro fertilization. Again, the success rate is so much better with IVF than it is with insemination. Someone asked, what is the ideal age to freeze your eggs? Honestly, the sooner the better. In other words, if you're in your 20s, we're gonna get more eggs, we're gonna get better quality eggs. Probably you will never to do that procedure again. In other words, if we get 15, 20 eggs on a 25 years old, there is really no need for her to undergo, that's plenty of eggs. But if a woman is 40 and she's undergoing an egg freezing, it's still okay to do it. There is really no age limit to do it. Let's say a woman is 40 and she want to freeze her egg. That's perfectly fine. We can do it. The only issue is that we may need to do it more than once, depending on how many eggs we get, because we expect to get less eggs with a slightly older woman. Also, the quality of the eggs will be affected. But again, it never hurts to freeze them anytime. The sooner the better. The younger you are, the better the result will be. Another question was, how does surrogacy work? Well, surrogacy basically means that we're going to do in vitro fertilization with your egg, your partner sperm, or a sperm from an egg bank, from a sperm bank, I'm sorry. We're going to make a baby and then an embryo, and we're going to transfer it into a woman that's usually not related to you. She could still be your sister, your cousin, your mother even. Uh, and it's basically transfer into her uterus. A few things really are involved there. Number one is creating the embryos. In other words, you have to go through in vitro fertilization. Number two is finding a surrogate. And finding a surrogate, could be expensive. It could be difficult to find somebody you feel comfortable with carrying your baby. Uh, there is psychological consultations that are usually done to make sure that you and the surrogate, are on the same term. There's usually a legal agreement that's signed between you and the surrogate that make everything clear from the beginning, who's gonna pay for the cost of the pregnancy, who's gonna pay for all the procedure, what if, God forbid, the baby has a problem, you know, will she be willing to, abort the pregnancy, etc. But more importantly, the contract will say that once the baby is born, the surrogate is going to relinquish the baby to you, and you're going to be the official mother, parent of that intended child, of that child. I have a question here about in what day of the cycle we start preparation for an insemination. It really depends what medications, your doctor is going to prescribe you. If we are using injectable medication, we like to start as early as the second, third day of the cycle. If somebody is using oral medication, something called Clomid or Letrozole, then they can be used a little later, day 3, 4, or 5 of the cycle. So the idea is really to call your doctor once your cycle start, preferably on day 1 or day 2 or even day 3, so we can proceed with the treatment. I have a question here about male factor infertility with morphology 100% had defects. The sperm count is 9.1 million, the motility is 57, and the patient age is 31. What are the odds to get success with any pregnancy assistance method? I think honestly that the odds are excellent. You are young, you're 31, you should have good eggs. And the majority of the time, if not all the time, the most important factor to be successful with in vitro fertilization is the quality of the egg. And the younger the eggs, the better. So I think given those numbers, the sperm count, the motility of 57 is fine. The morphology definitely show a lot of abnormal sperm, but with in vitro fertilization, there definitely could be good fertilization and good outcome. So I think the odds with in vitro fertilization at age 31 should be definitely more than 40% for taking a baby home. I have a question. Can you please comment on the process for transferring care to Boston IVF after already establishing care with another REI facility? Well, I mean, it shouldn't be difficult. You can just call the office, a Boston IVF office, make an appointment. We're gonna ask your fertility practice where you were previously to send us all your medical records. We will review them and we'll see you. I would think usually between the time of getting everything started, getting the records, it shouldn't be more than 2 to 3 weeks to be able to see you at a Boston IVF practice. A patient asked, my mother-in-law had breast cancer, my father-in-law has pancreatic cancer, and my husband 5 years ago had testicular cancer. After that, he froze his sperm, and now we want to have a kid. We want to know if Boston IVF does genetic tests, or what are the tests we can do to have healthy embryos. Well, the most important thing is to find out if there is a genetic reason why your husband and your in-laws had cancer. So testing is going to be done, genetic testing, to see if there is a genetic reason. If there is no genetic reason, we can just use the frozen sperm, either with insemination or preferably with in vitro fertilization to help you get pregnant. If there is a reason, then we're going to create a probe. In other words, we're going to create a test to see if your embryos carry that abnormal genetic issue or not. So we have to do in vitro fertilization. We're going to take a cell out of the embryo, and we're going to test this embryo to make sure it's normal and it doesn't carry that gene that causes the cancer. So the most important thing, though, is to initially find out if the reason for the cancer of your husband and your in-laws is genetic, and we can find out what gene it is. A patient asked, I'm currently a patient at CNY and not happy, I'm sorry. Where do you have offices in New York? We do have an office in Syracuse, we have an office in Albany, and we have an office in Rochester, and they're all accepting new patients and available. I have a question. Somebody asked, we want to move our embryos to another state. Is it safe to do so? Usually it is. The most important thing is if you want to transfer them to, let's say, an office in Michigan, for example, it will be good to send the report of the embryology to that center. Let the doctor there look at the result of your frozen embryos. How do they look? What day they were frozen? What technology was used to freeze those eggs? And then they will make a decision if they will accept them or not. But I mean, embryos are transferred at all time. They're transferred to places to have them stored. They're transferred to other clinics. So it's safe to transfer the embryo, but you just want to make sure that the doctor receiving those embryos is comfortable with their quality, with the way that they are frozen, etc. I have a question. I was told that I can freeze my eggs since I am over 40, but I was requesting to freeze them since I was in 30s, but my doctor kept saying to wait. But then we went into my 40s and they told me that they cannot do it. I mean, as I said before, you can definitely freeze your eggs at any age as long as you have eggs. In other words, your doctor is going to do a blood test, an ultrasound, see if you have eggs. Nobody want to put you through a process where we're not going to get any eggs recovered. But even if a woman is 40, 41, 42, as long as you have eggs that we can get out and freeze, that's definitely an idea. I'm sorry, your doctor told you that when you were younger, but as I said, a blood test and an ultrasound can tell us how many eggs you have left, and then we will advise you if it's worthwhile to proceed or not. But being 40, 41, 42 is not a contraindication to having your eggs frozen. How can I know that letrozole will work when 3 rounds of Clomid hasn't worked for me? Clomid and letrozole are basically the same, I like to call them that they're brothers. They're not 100% the same, but they do work the same. And for all practical purposes, when we do Clomid, it's as if we're doing Letrozole. In other words, if Clomid didn't work, you really want to make sure what is the next step. Is it time to move to more aggressive treatment? Is it time to do IVF? Because honestly, the difference between Clomid and Letrozole is practically the same. I was told by my doctor that I cannot freeze my eggs because I'm over 40. As I said before, it really depends if you have eggs or not. So you should do a blood test, a blood test, anti-Mullerian hormone, an ultrasound, or a day 3 FSH. Those are all tests that will tell us how many eggs you have. And if you do have eggs, there is really no contraindication to freeze your eggs. How do I choose a sperm donor? It's such an important thing to choose a donor. As I tell people, you have a choice. There are so many sperm bank out there. You're gonna look at the donor profile, what is their ethnicity, what is their race, what's their eye color, hair color, height, weight, etc., blood type, what do they like to do in their life, what degrees that they have, what are they studying. So there is really so many criteria that you can use. And there is so many choices, there are so many banks, and all those banks have so many specimens, so many donors. So you can be very comfortable choosing, the donor that you want. Uh, One thing that's important, you may want to have some genetic testing done just in case you carry any of those abnormal genes, gene that can cause a disease like cystic fibrosis, like spinal muscular atrophy, like Tay-Sachs disease. You want to be tested. So when you choose the donor, you make sure the donor doesn't carry any of the abnormal genes if you carry one. Because if both of you carry it, then the baby will have 25% chance of being born with the disease. So you want to be tested first. Once you have that knowledge, then you can take your time and choose any donor you want. One thing though, I want to say, sometimes my patient may spend days and days and days on deciding with the donor. And remember, 50% of that child genes are gonna come with you. I have so many people who spend literally months deciding what sperm donor to use. And then their kids are just mini me, they look exactly like the mom. And as one of them once told me, I could have chosen any sperm from anywhere and it wouldn't have made a difference. So it's very important to choose a donor you're very comfortable with. You like the characteristics of that donor. But again, do not go crazy over that choice. Is there a chance to have twins with IVF? There is definitely a chance of having twins with IVF. I tell you though, one at a time is better, one at a time is healthier. We all get excited. My wife was excited, hey, can we have twins? And honestly, carrying one baby at a time is easier. There is much less complication, preterm labor, risk of a C-section. So many complications can happen when people are pregnant with twins. So one at a time is always better. But sometimes, I might put one embryo in a woman's womb and then it may divide and the woman may end up with twins. So sometimes, if a woman is older than 37, 38, and she asks us to put two embryos, we do put two embryos and it may result in twins. But again, try to listen to your doctor's advice. One at a time is so much safer for you and for the baby. The next question is, does coffee affect the quality of the oocytes? So coffee really does not affect the quality of the eggs. Uh, Coffee is not bad, you know. Uh, Coffee is not bad for sperm or for eggs in that matter. Now, if you drink, 10, 10 cups of coffee a day, you will need to decrease that when you're pregnant. Usually when you're pregnant, we like to advise people to drink only 2 cups a day. But coffee is not going to be harmful to your eggs, and it is known to be good to sperm, people who drink lot of coffee. Now, don't tell your partner to have 20 cups today, but coffee is not bad for either the eggs or the sperm. Can you talk about alcohol during frozen embryo transfer? Well, once you're pregnant, alcohol is a no-no. You may slip, have a sip of a glass of wine or a sip of beer here and there. But, we tell all pregnant women, please do not drink alcohol because an excess quality of alcohol can lead to problem with the baby. The baby will have small head, they will have a lot of developmental abnormalities, etc. So from the day we put the embryo inside, in other words, from the day we transfer that frozen embryo, you should honestly stop drinking alcohol if possible. That will be the advice. Now, if you drink 2, 3 days before the embryo transfer, that's fine. Your body's gonna metabolize it and it's out of your body. But starting the day of the embryo transfer forward, try to avoid drinking any alcohol. How long after a birth is the patient usually able to do another transfer? It really depends on you. If you want to breastfeed, how long you want to breastfeed for, because the medication we give you to prepare you from an embryo transfer is gonna dry the breast milk. So let's say you're not breastfeeding, you're using a bottle, you deliver 3, 4 months ago, sure, we can do another transfer. I would say 3 months and up if you're not breastfeeding, but if you're breastfeeding, we need to stop. You need to stop breastfeeding at some point and then proceed with a frozen embryo transfer. If an over-the-counter ovulation test show ovulation, does that mean you can definitely get pregnant? Unfortunately, no. The ovulation predictor tests over the counter are pretty good at predicting ovulation, but they have never been proven to help people get pregnant. In other words, if people have sex 2, 3 times a week, or people have sex only around the time of ovulation based on that kit, it doesn't seem that the one who are having sex only around the time of ovulation are getting pregnant more frequently. So you're not gonna definitely get pregnant, depending on your age. If you are 20, maybe your chances of getting pregnant every month are gonna be 35, 40 at the most. If you are 35, then it's down to maybe 10, 15%. So it's really depend on your age. Unfortunately, that test is not gonna, predict that you're gonna get pregnant or not. Thank you so much, Jen. Jen said, thank you so much for doing this. Thank you so much for listening to that. The next question is, my partner and I are ready to start treatment. On our first appointment, do we do testing or is it just a chat? Well, ideally, the first appointment, the doctor is going to take a good history, the healthcare provider, the doctor or the physician assistant, the nurse midwife are going to take a good history from you and your husband, anything from what medication you're on, how often you have intercourse, very, very detailed information. And then depending on that history, the doctor is going to order all the tests. So when you leave the office that day, the doctor is going to give you appointment to come, for example, to have an X-ray to check your tubes, to have an ultrasound to check your ovaries. You're going to be given a request to do so and so blood tests. And your partner ideally will also be scheduled to do a semen analysis. So the first visit is a chat, but it's also ordering all the tests that will help us figure out why there is a problem, if any problem. Casey asked, what are the steps to make an appointment to see a doctor at Boston IVF, and how soon can a person get appointment? I mean, all you have to do, honestly, is just call a Boston IVF office. Depending on the office and the location of the office, some offices might be slightly busier, but usually I would say within 2 to 3 weeks, you should be able to get in and see a provider, and start your journey through that. What is the downtime for making embryos, and what is the price for making embryos and for freezing them. So to make embryos, there is the preparation. You need to meet with the doctor. They need to find out what's going on with you, what's your partner's sperm, and all of that. And then basically we can start with the process. And to make the embryos, as I said before, from the day you start treatment until the day the embryos are transferred or frozen, it's going to be approximately 20 days. And during those 20 days, there's a day where you cannot work, which is the day where we take the eggs out, not because you will be in pain or anything like that, but because when we take the eggs out, you are given some anesthesia, and we don't recommend that you drive or go to work that day. But you should be able to work regularly during those 2 weeks period. You really don't need to take that much time off. Unfortunately, there is always, you have to make your appointment. I would say it's approximately 4 appointments, and usually 4 appointments, so we'll have to make time for those appointments. Are sperm donors tested for autosomal dominant conditions too? Yes and no. It really depends on the sperm bank, and it really depends, right now, I guess most sperm bank have donors that are already tested, but it's something, before you buy it, it's always a good idea to call the sperm bank and ask questions, how many times did this donor give? How many times did he produce a pregnancy? What was he tested for? And they should be able to answer, not they should be able, they have to answer all those questions, explain to you, how many times this donor, how many kids he has. They should have this information, uh, or at least they should at least have an idea, because some people may still be using that donor and are not pregnant yet. And they will answer your question about what genetic testing was done on those patients or not. What's the oldest woman that had a child with her own eggs at our center? I mean, I had 44 and 45 years old, but honestly, this does not apply to everyone. In other words, you know, it is tricky. It really depends, if you have eggs or not. It really depends on the quality of the eggs. And again, this is something that your doctor will be able to tell you after doing the preliminary testing, how many eggs you have, what are the odds of getting pregnant with those eggs, etc. And usually, I mean, for every patient, uh, the Society of Assisted Reproductive Technology, it's the society that monitor all the success rate in the United States, and we are part of it. They have a calculator that can give you an idea about what are the chances of getting pregnant. You have to put your weight, your height, your age, if you were pregnant before, what is the reason for the infertility, and they can give you a number, which is pretty accurate. And at the same time, when you see your doctor, he's going to give you a number. You're 44. This is what our success rate is here based on your lab results and everything. Your success rate is going to be so and so. And then it's up to you to decide if you want to proceed or not. Do you have a limit on the age of the woman? Uh, some centers, have a cutoff age of 4 years. I don't really have a cutoff rate. Definitely when a woman reach 44, the chances of getting pregnant, unfortunately, are gonna go down significantly. I do rely on the egg, but at the same time, I do rely on the testing that we did to advise you, if it's worthwhile to proceed, or it's time to consider other options like egg donation, adoption, or child-free living for that matter. Can we do a mini IVF if my wife is young and healthy to save money on medication cost? I mean, we can always do a mini IVF. I have to warn you though, the medications are expensive, true, but at the same time, the IVF process is expensive. When you do a mini IVF, we can get one 2, maybe 3 eggs, the odds that those eggs are going to be healthy, are going to fertilize, are going to develop into a good embryo that's going to implant and result in a live birth, with every step, the odds come down a little bit. How many eggs you have? Are they mature? Did they fertilize? What happened with them, etc. So I know, she's really young, and young and healthy is good. Young and healthy means that her eggs are better quality, so that's all good. But at the same time, you can think, if you try to save money on the medication, you may end up having to pay more money in the future for additional IVF. So sometimes it's better to just do one course of regular IVF where we can get a good number of eggs, let's say 10, 15, 20 if the woman is young, and get 4 and 5 embryos that are healthy. She get pregnant with one, she want to have another baby in the future, then we can just throw it and put it inside, and she doesn't have to go through all those expenses of IVF and all those expensive medications. So, mini IVF is okay, but you need to think about at the end of the day, which one is going to be better for you and which one is really going to save you money. Is it better, healthier to transfer fresh embryo or frozen one? So many years ago, fresh was always better, but right now the technology that is used to freeze the embryos is excellent. So I would say the success rate of fresh and frozen is the same. However, sometimes when a woman develops too many eggs, then the womb may not be as welcoming to a pregnancy. So sometimes it's better to freeze the embryos and come back a few weeks later and do a frozen transfer. But if you're given a choice, if if you don't have too many eggs and you have a fresh embryo, then freezing or fresh are exactly the same. There is really barely any damage from the freezing technique that's used nowadays. A patient asks, I'm 33 years old and I have 2 frozen embryos. Would the best option be to collect more eggs and try to have more embryos before a transfer? This is such an important question, and it depends on few things. You're 33, you're young, you could proceed with the frozen embryos, unless, if you have only 2 frozen embryos and you want to have, let's say, 4 children, then maybe it will be better to bank more embryos for the future. The other question is, were those embryos tested? In other words, are they normal embryos or not? So all of that will have to be taken into account. How many eggs you would like, how many kids you would like to have? Are those embryos tested or not? If they're not tested, then the odds are a little lower. So maybe it will be a good idea to freeze more embryos if you plan to have more than 2 children. But if you're planning on only having 2 children, maybe it's better to just transfer one of those embryos at a time and see what happens and then take it from there. Good luck with that. It works, especially if they're normal embryos. The odds at age 33 are great to implant and have a healthy baby. How reliable are home fertility tests like modern fertility? Again, it's really tricky. And honestly, if you feel that there is a problem getting pregnant, then just have your doctor, your fertility specialist, or even your gynecologist, just order the necessary test. Uh, doing the testing at home, I mean, they are reliable, but how reliable compared, to a laboratory testing that's done in a lab, it is hard to tell. Uh, and honestly, as I said, if you do have a problem getting pregnant, just ask your doctor and just do the testing that they will order for you. I think that will be easier, and that will give you, I think, better answers to what's going on. I am very allergic to medication. How if I have allergy reaction during egg freezing treatment? The medication that we use to make you produce multiple eggs is something that your body produces. In other words, we're not giving you something weird or something that you don't produce yourself. Let me try to explain. Usually, every month your body produces a number of eggs. One eggs make it, the other die usually. Why? Because your brain produces a hormone called FSH in a small quantity. The medication that we give you to produce more eggs, to save those eggs from dying, is that hormone that your body produces. So ideally, you should not be allergic to that medication because your body produces it. We're just giving you a little bit more of what your body produces. I hope that answered that question. The next patient is asking, she's 32, but her husband is 52, and they would like to have children, but they have tried and didn't work so far. He's hesitant to be tested and feels it's not a sperm issue. He is unfortunately required to do a sperm test. She's asking me if does he have to have a sperm test. Unfortunately, yes. You know, we don't want to give you medication. We don't want to treat you without knowing what's going on there. You know, the treatment may change. There may not be any treatment, let's say if he doesn't have sperm, etc. So, you know, as a couple, we treat the couple. We try not to treat, you know, one person without the other one. Now, if you're a single woman, sure, you know, you're welcome. We treat you all the time. But I'm saying for a couple who's trying to have kids together, it's really best for both of you that both of you get tested so we find out what's the reason for the fertility issue and treat it. I would hate to do testing on you and give you medication just to find out later that, oh, you know, there was a problem with his sperm and you were perfectly fine. So it's really good that he need to be tested. How can I make an appointment with you? I want to have an IVF. I mean, you can just call our office. Uh, you know, we're online. Just go to Boston IVF. There are multiple, Boston IVF has multiple centers, you know, all over the US. And it should be very easy to get an appointment with us. The next patient is asking, I'm a Boston IVF patient and I'm debating between IUI insemination or IVF. I have polycystic ovaries and no longer ovulate on my own. The sperm was perfect. Uh, my body did not respond to 3 rounds of Provera and Clomid. Uh, you know, the problem with polycystic, you know, we have very powerful medications other than Clomid and Letrozole, but the problem with those medication is that they may make you produce too many eggs. You know, every time you hear on the news this woman is pregnant with 6 children or 7 children, you can guess that she has PCOS and she took those powerful medication. Now it's definitely worth it. Try with letrozole, you know, increasing the dosage slowly but surely to see if you will respond and if you will produce an egg. But if you don't, then it might be a really good idea to go to IVF because, you know, it will minimize the odds of being pregnant with 3, 4, 5 kids at the same time. And it will be the safest thing for you to do. But it might be definitely worth a try at letrozole first. What is the risk of birth defect or future complications such as behavioral and or developmental delay when using ICSI compared to that of IVF or natural conception? Well, there is multiple studies. You know, IVF was started such a long time ago. I think Boston IVF started in 1985. So long time ago. And there are millions of children born with IVF, born with ICSI. ICSI started around 1993. So lot of children born with both IVF and ICSI. And honestly, the developmental delays or the congenital malformations are very, very rare. ICSI, when you take a sperm and you stick it inside the egg, has been associated with a slightly increased risk of an abnormality of the baby, not a developmental abnormality, but a bodily abnormality. And IVF also has been associated with a very, very slight increase in heart defects of the baby. But it's honestly such a small decrease, and it's something that your obstetrician knows about. And when you're pregnant, they're going to check to see if there is any issue with that. Now, there is really no significant report at all of developmental delay or behavioral abnormalities. Actually, kids born to IVF seems to be much better adapted. They do much better in society, at work, etc. And not because the patient got pregnant with IVF, but because, a patient who went through IVF is not going to just throw her kids on the street and forget about them. She's going to really take very, very good care of them. So to answer your question, I think that we know that, the odds of an abnormality are very, very low. And I would recommend, if you go to our society website, ASRM, American Society for Reproductive Medicine, they have excellent statistics that they can provide you with. It's on their website, excellent statistic to answer those questions specifically and give you maybe a little more detailed number than I can give you now, but the numbers are really, really minuscule, very, very small. I'm 45-year-old trying to have a baby with my fiance, but I have kids. My last is 4. Will it be possible to conceive? I mean, it's definitely possible. We've had people, my wife is an obstetrician. She has people who are 48, 49 who get pregnant spontaneously without any help. It is possible. The odds are not very high, though. And if you really want to be, want to be aggressive about it, it might be a good time to see a doctor who will do some testing, and they can give you a number about the probability of you getting pregnant. They may tell you it's less than 5%, it's 7%, 8%, 10%. But unfortunately, at age 45, if you look at the national statistics, the odds are definitely less than 10% of getting pregnant with any treatment, IVF, insemination, or no treatment at all. What is the most recent study about the chances of having a baby for a healthy woman from her frozen eggs? It really depends when those eggs were frozen. If you were in your early 30s, 28, 29, then the odds are really, really good. Ideally, we think that an average of 6 frozen eggs is needed to have a live birth. But again, those are just numbers that may not apply to you specifically. When were those eggs frozen? How many eggs you had frozen? What is your ovarian reserve now? How many eggs you have now, which will give us an idea about the quality of the eggs. But when a woman want to buy frozen eggs, most bank will sell 6 eggs at a time, because the feeling is that 6 eggs should be able to result in one live birth. That's not always true. Sometimes we can get more than one baby from 6 eggs. Sometimes, unfortunately, we don't get anything. So a lot of factors here, what age they were frozen, how many you have frozen. But the younger you were, the better the odds. Is there a certain time within a menstrual cycle that's best for the blood test to check the amount of possible eggs? Sure. So there are few tests that we do. One test, we like to do it on the 2nd, 3rd, or 4th day of bleeding. So let's say your period start today. Today is Thursday. We'd like to do it on Friday, Saturday, or Sunday if you find the lab open that day. So day 2, 3, 4 at the latest, that will be the best time to do this test. And this test is called FSH and estrogen level. Now, there is a test called AMH or anti-Mullerian hormone that can be done anytime during your cycle. Doesn't matter if you're bleeding, if you're ovulating, it doesn't matter. It's a pretty accurate test. Usually we like to order the AMH and the day 2, day 3 FSH and estradiol level. It's the more information we have, the better. And usually we like to do an ultrasound to look at your ovaries to see how many eggs are there. And by putting all those results together, we can give you, a prediction. What are the chances of getting pregnant? You have good eggs. You don't have too many eggs. We need to be more aggressive. We make a plan. Actually, I think most of our plan are based on that test that we do. So day 2, 3, or 4 at the latest blood test, and an AMH level that could be done at any time, and an ultrasound that could be done at any time. All the current numbers about IVF odds are based on women who had fertility issue to begin with. There are no studies based on healthy women who had babies with their own eggs over 40. True. There are though like a lot of IVF cycles that are done because a woman had, let's say, 2 kids, didn't want to have kids, tied her tube, decided not to have babies anymore. So we know that this woman is fertile. She changed her mind. She has a new husband, a new boyfriend, or she just want to have more babies. She decided to. So we know that this woman is fertile. She did get pregnant before without any problem. And the reason she's not getting pregnant now is because she tied her tube. So those women are usually fertile. As I said, they do not really have a fertility issue. They just have tied tubes. So we can extrapolate the success rate of a woman who does not have fertility issue from those women themselves. When we do IVF, their odds of being successful are much better than somebody who has a sperm issue, who doesn't have good eggs, who have endometriosis, etc., etc. So I agree with you that maybe we don't have numbers on healthy women who get pregnant, but again, there is enough data, there is enough tables that we can tell a woman who's 40, let's say, if you try, who's perfectly healthy, doesn't have any problem, just by looking at the data that's out there, a woman who's in her, let's say, 40 years old, her chances of getting pregnant by having intercourse, etc., is gonna be maybe 10, 15% every month. So every month the chances that she will get pregnant if she has no fertility issue is around 15% at the most in this age group. I hope I was able to answer that question. How many eggs can take of a woman with 40? How many eggs can we get from a woman with 40? Again, it depends on the woman. If a woman has polycystic ovaries, we may get 10, 15 eggs. This is something, that we will let you know once we look at your blood test and we can have an idea about what our expectations are. I mean, when we start an IVF cycle, we try to be as aggressive as possible because we want to get as many eggs as your body will allow us. If you're young, we're not going to be that aggressive. But let's say you don't have too many eggs, we're going to use a higher dose of medication. We're going to use a different protocol to allow your body, hopefully, to produce as many eggs as we can use, to help you get pregnant in the future. So it really depends on your blood test, but your treatment will be based on those blood tests. We will decide what protocol to use, what dosage to use, etc., to try to get as many eggs as your body will allow us to. How much does it cost per year to freeze the egg? So let's say a woman went through egg freezing, she has eggs, they're frozen. So there is a fee to store The embryos, just like you store something anywhere, you have to pay a fee. It depending where they are stored. For example, at Boston IVF, they can be stored at Boston IVF. At other centers they might be shipped somewhere else to freeze them. So it really depends, where they're frozen, but there's a yearly fee. It depends on the place. I think it can vary from anywhere $300 to $600 a year to keep the eggs frozen. What would be your recommendation for wait time between a hysteroscopy-myomectomy and heal time for FET, for a frozen embryo transfer? So, a hysteroscopic myomectomy, there hasn't been much damage to the uterus. In other words, the uterus was not cut open and we need to wait a much longer period, for it to heal. So, I mean, usually what we do, I would say 2 months to heal and then do an ultrasound, make sure the lining of the uterus, you look fine and heal, and then proceed with the frozen embryo transfer. Earlier, maybe if you're in a hurry, the doctor could do an ultrasound, look at your lining, make sure everything is back to normal, and then proceed with that. But there is really, once the lining of the uterus is good, there is really no reason to wait too long because, there's the fear, will a fibroid come back, etc. So do not wait too long for that. Uh, Tiffany is asking us about the cost of one full successful IVF cycle. Uh, I mean, the problem is, I'm not sure what is, unfortunately, nobody can predict that the IVF cycle is going to be successful. We, the doctor, your doctor is going to do everything they can to make it successful. So, I mean, an IVF cycle, the price vary. I would say an average of $10,000 to $15,000 in most centers to do in vitro fertilization. There are some, I know, like Boston IVF in New York, we are associated with a place called Sunfish. You can find it on our website. And what Sunfish does, they look at your history, the cause of infertility, and then it's like buying an insurance, for your car. If you damage your car, the insurance will pay. If you do IVF and don't get pregnant, you will get, a big chunk of your money back, etc. If it's, something you might be interested in, you can look at the Sunfish website and you can find the place to log in from our website, Boston IVF New York. It's called Sunfish. It's one word. Can you please sorry. Hey, Maureen, thank you. Uh, what's the price of making embryo? It's the cost of in vitro fertilization. Again, it's gonna vary between $10,000 to $15,000 at most centers. Gladys, I'm not really much into the payment plan, but it's something that you can find easily by calling the office. They will explain all of that to you. What is your opinion on egg rejuvenation with stem cell? Uh, you know, I've had, unfortunately, a lot of patients who went to New York City or other places to undergo egg rejuvenation. Uh, Unfortunately, I'm not a big believer in it. People are using stem cell for many reasons. They're using stem cell for people who lose their hair to grow more hair. They're using stem cell, in people who have surgeries to their knees, etc. But there is honestly no proof that it works. And that's why when it's done in the United States, it is part of a research project. In other words, the doctor cannot just offer it to you as a treatment. They can offer it to you and explain to you that, listen, this is a research. We don't know if there is any advantages or not. We don't know if there is any disadvantages. So unfortunately, as of now, I would not recommend, egg rejuvenation yet because there is no proof that it works. We don't have yet any strong scientific evidence that it makes any difference. In other words, that it will lead to having healthy babies later on. I'm 32 years old and I want to freeze my eggs when I'm 36. Is it too late? It's really not too late. It's a difficult decision because, some people want to freeze their egg because they're following their career. They didn't meet yet, their mate. They didn't get married. They don't want to have, before meeting like that special person with whom they want to have children. My answer to you is again, the sooner you do it, the better. Uh, it's better to do it at 36 than at 40. Hopefully, you will not need to do it by the time you're 36. Hopefully, you would have decided to get your kids and be pregnant, etc. But if you have, a thought about freezing your eggs, then I will do it sooner rather than later. As I said before, you're gonna get more eggs, better quality eggs, with much higher chances of those eggs resulting in a healthy life birth and a healthy baby. If you have large fibroids with heavy period, can you still be able to remove your eggs and freeze it? It's it really depends on only one thing. So the presence of the fibroid should not prevent you from freezing your eggs. They're not gonna interfere with the quality of the eggs or the freezability of the eggs or anything like that. The only thing I want to warn you, to freeze the egg, we need to be able to see the ovary to suck the eggs out. And sometimes a fibroid may be in the way, so we may not be able to reach your ovary to suck the eggs. And this is easy to find out. You just have an ultrasound, and your doctor will tell you, oh, your ovary is right here. They're easy to reach. So having fibroids is definitely not a contraindication to freeze your eggs, and it doesn't affect the quality of the eggs at all. The only thing, as I said, I want you to be careful is just make sure that we can reach your eggs to remove them and freeze them. Sometimes the fibroid may be in the way, and in this case, usually we ask the person to have surgery to remove the fibroid to be able to get to the eggs. Tiffany said, thank you so much. She's learning a lot. Tiffany, thank you so much for your nice words. Thank you, everybody, for your questions. Thank you for listening. I'm sorry you have to go through this. I'm sorry you have an issue getting pregnant. I hope you don't, but if you have, I'm sorry you have that. But believe me, there are a lot of things that could be done to help you, get pregnant in the future. And remember, the sooner you start, the better. Unfortunately, some treatments might be expensive, but if you put, babies are expensive, diapers cost a fortune when the baby is born, uh, not to mention when they're teenagers, etc., etc. Anyway, thank you so much for listening to me. I wish you all good luck and have a good evening.